in your introduction, as you were saying, how our environmental exposures, we're noticing that young girls are getting periods earlier. There are more period challenges, that girls are experiencing in general. These are all signs and symptoms of a broader conversation, of a much more, of a bigger conversation that we often don't actually get to have, is that fertility is transgenerational, and it impacts us even before we're born. Of course, women, we are born with all the eggs that we will ever have, but every single one of us was in our grandmother's womb as our mother was being gestated, before we actually made it into the world. So that's the frame and the lens that we need to take reproduction and whatever is going on in terms of fertility from, because if we don't, we certainly leave a lot on the table, and we expect that when we actually want to be pregnant, that's the place and time to start improving and optimizing the chances of taking home a healthy baby. And we know that's actually not true. We know that there is so much that can be done when a woman is pregnant, when a girl is growing up, and a boy. Really, fertility is a team sport, and we're certainly noticing that boys are being equally affected. There was a really interesting prospective analysis that actually demonstrated that men had a 50% decrease in terms of their sperm parameters in a period of 50 years, and that doesn't just happen for no reason. It's happening because of these exposures that we are involved in and surrounded by. It's almost like we can say that we're living in a chemical soup, to the greatest extent, and that is affecting our fertility and our chances of taking home healthy babies.
So, would you say that is the biggest hurdle that is affecting fertility today?
I think that there is a combination of factors, and one of the things that is really super important to take into consideration is that, yes, we have our exposures, and there are many different things within our day-to-day environment that we have to protect ourselves from. Whether we're talking about microplastics and endocrine disruptors, or we're talking about radiation or heat, or, toxic elements in the air. There are many different factors that we do need to take into account. But the one big thing that I think often gets misunderstood, misclassified, and really not done very well is the diagnostic piece. Because if you think about it, most people who are experiencing fertility challenges, the healthcare system is not designed for the ability to really get in-depth answers and clarity about what is actually not working. So for the majority of couples who are struggling to conceive, they are told everything is normal, just keep trying, from like three different types of blood tests, right, that are basically done on a woman. Are we ovulating? Do we have do we have eggs? Do we have a uterus that is functional? And so basically, and sure, sexually transmitted infections are typically screened for, but that's it. And so if you're only just doing a few hormonal tests and looking at whether a woman is ovulating, whether she has clear fallopian tubes, and whether she has a uterus, and then you don't actually even test for the semen analysis to find out what's happening with the sperm. And when you get those results back, you're simply using the lens of reference ranges for ascertaining whether there is something that is out of optimal range, as opposed to just normal lab references, which, by the way, when you go and do a blood test, most labs use reference ranges that are essentially derived from the population of patients they treat,
Right.
which basically means that who are the people going to have blood tests? Are they the healthiest people in the population? Of course not. They're usually the sickest people in a population. And so those reference ranges become the average of the sickest people in the population, as opposed to the optimal function of the body. And so from that, when you hear, everything is normal, just keep trying, you have to take that with a massive bucket load of salt, not just a little pinch, because what ends up happening is that, really you're being told something that is completely counterintuitive, because if you think about it, what is normal when you're talking about having a baby? It's have sex, get pregnant, have a baby, right? When anything deviates from what is normal, it may be common, but it's certainly not normal. And so understanding what else is getting in the way, what are the other underlying factors? And mind you, big clue here, it's not just going to do with the egg, and it is not just going to be to do with the woman. It's, fertility is a team sport, as I like to call it. And so you have not just female factor, not just male factor, you have embryonic factors to take into consideration as well, which obviously will give us the ultimate outcome that we are looking for. And anything that could stop implantation from occurring is also going to be problematic. So, it's a big conversation that most people want to simplify too much, you see, and that's where we start having these very ineffective conversations with caregivers, because it's like, well, if everything is normal, then what is wrong? Oh, it's unexplained. What are the diagnoses in literally medicine, right, is given by self-reporting a length to outcome? There is no other, right? Like, there is no other diagnosis that you go, oh, yeah, I think I have a bone that's broken in my body. Like, okay, by what objective measure do you think that, right? With infertility, it's literally, you go to a doctor and you say, I have been trying to have, yeah, most people don't try to have sex, they just do. But I have been trying to have a baby and it hasn't happened. The doctor will ask, how long have you been trying? How many cycles have you tried? Have you timed? And from that, just, I've been trying to have a baby and it hasn't happened. The second that you tell that person, that doctor, the number of cycles, if it's close to 12 or if it's over 12, they will probably say, oh, okay, here's a referral, go and see an IVF doctor, right, for the workup, the tests and the things that you need to do. But the reality is that at that point, you have been diagnosed with infertility. The reason, the cause for that diagnosis is unexplained.
Right.
Does not mean that it's unexplainable. It does not mean that there aren't actual real answers that you need to find to understand so that you can actually intervene in the accurate way for that particular individual and couple. You see, I often see men with poor sperm counters, and as I go through each consultation, I look at the exposures, I look at what's going on. And over now, the last 2.5 decades that I've been doing this work, it is very, very possible to line up 10 men with poor sperm morphology and have 10 different ways in which to address that based on the individual. And so it's not going to be a situation that a one size fits all approach helps couples overcome infertility, recurrent miscarriage, and failed treatments when it hasn't been straightforward, when it has been challenging, and when it has been difficult. And we have to disentangle this understanding from the fact that most people in the general population will conceive without trying, will have a baby without any events to report. The deviation from that is where we need to get very, very good at understanding and disentangling, because what happens is that when it hasn't been straightforward, that's where we need to really be looking at intervention, not when, oh, it just hasn't happened and we haven't really bothered to explain why, you see. And so, and look, it's really difficult when a couple is experiencing infertility to really get to the bottom within the healthcare system, to really get to the bottom of what's going on for that situation. And the reason is that the healthcare system in every country pretty much is not designed to address these difficult, complex situations. It's designed to do, public health. It's designed to really give the absolute most, which ends up being the absolute minimum, to the greater number of people, to the greatest possible number of people, right? And so what does that mean? Well, essentially, it means that if it's going to cost, from a cost effectiveness perspective and a decision health science perspective, if it's going to cost the same amount of money to treat a condition as it is to prevent a condition, prevention is not necessary.
Right.
That's the thought of the healthcare system, right? Because it's like, well, we're going to end up with the same problem anyway, right? It's only on an individual level in terms of cost and having to pay. It's only on an individual level that then we start to look at, okay, what is the impact on quality of life, on mental health, on various other metrics of importance to me as a person, not as a member of the general population that is a number and becomes a statistic. You see, and so that's where when I hear patients tell me from their doctors, oh, it's a numbers game, just keep trying. Well, sure, infertility might be a numbers game in the general population from a general population perspective, but to the individual, it's actually quite binary. I either have a baby or I don't, right? And if I'm not where I want to be, that is a problem that I need to overcome as an individual. And when I'm not getting the help and the support that I need, well, how else can I get that is really the question that needs to be asked, because
Yeah.
it's not going to happen within the system.
Right. And then that only adds to the stress, which then adds to the lack of chances that you're going to actually get pregnant. The stress is huge. I remember I have 3 children. The first one happened easily, actually. The second one, I'm a type A personality. When it didn't happen within 2 months, I'm like, oh my gosh, what's going on? And, I was diagnosed with PCOS, which is, the number one cause of infertility, correct? So
Yeah.
I'd love to talk about that. But it is everything to you when you can't get pregnant. So just what you're saying, okay, there's a small chance that you're going to be one of the people that's not able to have a healthy baby. But when you're that person, it's everything. And
Yeah.
the stress level skyrockets, cortisol disrupts the hormones more, causes leaky gut, causes all these other mechanisms to happen in your body, which says to the body, I'm not in any condition to support another child, let alone take care of myself. So I'm not going to get myself pregnant.